communication does remain a fairly high issue that people are concerned with. How do I better communicate with my social worker? My attorney doesn't return my calls. I only meet with my attorney just prior to the hearing. People come to us and don't get sufficient communication, or they are worried about the nature of that communication. I have a hard conversation yet. And this, by the way, because our visitors can be bio parents, foster parents, social workers, this category applies equally in that all of our visitors, not all, but a good percentage of our visitors call us and say, listen, I have a conversation that I need to have, and I can use your assistance in having it. And that's certainly one of the functions that we're there to serve. Language and identity cases are very low in our office. Social worker behavior or conduct. Now this is also one of the higher categories. People call us up and say, my social worker has treated me wrongly, and here's why. It's important to note on these graphs, and certainly in this one in particular, that this isn't the finding, quote unquote, the finding per se of the ombuds. Meaning, we don't confirm your perception or cast it aside and say, no, your perception is not valid. Ultimately, we take the visitor at face value. If the visitor says, I believe that the social worker's behavior or conduct was wrongful, it makes it onto the aggregation of trends like this, irrespective of whether the ombuds may believe that the social worker acted wrongly or rightly. Visitation issues remain low. Legal process or records issues remain low. Now, Lori spent quite a bit of time, and our numbers essentially mirror that that Lori was conveying. I haven't included every ethnic demographic on this chart, because when I did, it started to look unintelligible. But the truth of the matter is that the representation of Latino, African American visitors to our office remains higher than, for example, the Asian or Pacific Islander contingency. There's also another component. It is important to note that the Ombuds doesn't request data on ethnicity when parties contact us. But to the extent that a party, a visitor, calls us and says, I'm having difficulty because I'm Latino and my social worker is white, that's certainly an issue that would be tracked with respect to Ombuds aggregation of trends. How do we report trends? Well, one of the qualities of the Ombuds at the beginning of the slide, at the beginning of the presentation, was transparency. And it's important that the Ombuds report, of course, to the agency, and so you'll see to Ms. Medina, to Dr. Sessions, to Dr. Smith. And Dr. Smith comes about because my office, the Office of the Ombuds, is housed externally to DFCS. We take an external view. We are not social workers. We don't report per se up the line of command of social workers. We are independent. And so one stream of the Ombuds reporting is to Dr. Smith, the county's executive. The Best Practices Committee, and this was mentioned by Ms. Medina as well. The Best Practices Committee was an initiative brought about 8 years ago. And it was a recommendation at that time by the then Ombuds services provider, based upon the notion that there were complaints coming in from the community. And ultimately the community reported that they didn't feel like they had a voice. They didn't feel like they had a connection to the agency. And so the Best Practices Committee was created with 18 seats 11 of those seats were provided for the community. And so now, since that time, on a quarterly basis, the Best Practices Committee meets to review cases, although non-specific concerns, these trends. Certainly there have been a number of initiatives discussed, and so that's essentially the charge of the Best Practices Committee. The Ombuds also reports to the Children, Seniors, and Families Committee of the Board of Supervisors. And so on a twice yearly basis, the Ombuds produces a report that essentially says, here's the quantitative data, here's all the numbers, and here are the issues that remain outstanding, or here are the things that the Ombuds has taken note of. And oftentimes, over the years, many of the chairs of the Children, Seniors, and Family Committee have asked for specific follow-up or feedback, and certainly that's a place open to the public whereby they can hear about the function and the findings, if you will, of the Office of the Ombuds. Some of the notable trends from our operations over the last 7 years. Well, our visitors are largely from communities of color, 60 to 76%. Notably, many of the visitors to our office are female. In these last many years, since 2004, we have assisted in 742 cases. If you're doing the math, it comes out to be somewhere between 10 and 16 cases a month on average. And so when social workers are dealing with 13 to 16 cases caseload each, I'm sure that's not monthly. So our case volume is much lower. That allows us the opportunity to work much more extensively with each of our visitors and to provide some of that one-on-one time that's really necessary to answer all those questions. Those 742 cases have impacted or touched and concerned almost 1,400 children. And while the expense for the Office of the Ombuds for these years now remains relatively low, under $1 million in terms of its budget since 2004, the Code of Civil Procedure, in its section trying to quantify the benefits of dispute resolution, talks about the savings from these types of efforts. And so the Ombuds, on one level, when it can help with a case, when it can save time that might be spent in conflict, there's a quantitative savings there as well. Of the recommendations made by the Ombuds in the years either to the Children, Seniors, and Families Committee or best practices, largely the Ombuds and the department agree on what should occur. And the responsiveness by the department is very good. We work in concert. It's not the Ombuds' function to make recommendations, although the Ombuds certainly has that capacity. And so sometimes we are just that canary in the coal mine, saying, listen up, pay attention, here's something you want to take note of. Now, you, the department, figure out how to handle that. And sometimes the Ombuds will say, here's the issue, and have you thought of this, 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 and this in terms of addressing it? We're not quite at questions yet, so I want to hand over the mic and the presentation now to Ms. Silva. And thanks for your time. We'll answer questions. Thank you.
Before you sit down, we got a lot of Facebook questions, and the majority one, I'm sorry, is they want to know the difference between the ombudsperson and the internal complaint person. So if you could just really briefly, because we're way over time, address that so that members of the audience know the difference between what Ms. Medina is talking about and what you do.
Okay. And if I miss something, you'll help me out. There are ultimately, I think, many pathways to a destination. And the Ombuds functions in some ways quite distinctly from the internal mechanism, and both of those functions have, I think, the same goal or the same charge. Now, the Ombuds operates with confidence in the sense that the visitor who contacts us gets to decide whether or not we share their identity with, for example, the social worker. So that confidence is one area of distinction between the Ombuds and the internal complaint mechanism. Neutrality. Ultimately, as the Office of the Ombuds are not social workers, we're not clinicians, we operate with absolute neutrality. The internal mechanism isn't charged per se with neutrality. The Ombuds, well, let's see here. I may have. One of the mechanisms that would differ is that the Ombuds operates very informally. And certainly, while the internal mechanism works in many respects in that same way, it is, there can be a much more formal complaint mechanism. And sometimes that's ultimately what people are looking for. They'll call up one function or the other and say, I am interested in filing a formal complaint against the social worker. The Ombuds is not the place to do that, but the internal function would be. And ultimately, that form, there would be a form filled out, that would be tracked, so on and so forth. So the formality versus informality might be something. The Ombuds is external to the agency. Of course, the internal function is internal to the agency. The internal function of complaint mechanism has a social work expertise. The Ombuds does not have a social work expertise. The Ombuds looks again at communication, at relations, and dispute resolution in a much more mediator-like fashion. The Ombuds may generate options with parties. I think that's one of the vital functions of the internal as well. But I think the internal, who is in the position of the social worker, will have the opportunity to look at the progression of the case and to ultimately inform the client about whether their concerns are warranted or have violated practice or policy or have not. I think that's the start of the grade. There may be some other finer points.
So when we have questions, there's the other question we have is how this Ombuds position is formed.
I can speak to that in 30 seconds.
Okay, and if we can have the question mark off, we're going to say.
Okay. The Ombuds was formed in 1990. And ultimately, that was on recommendation of the Harvey M. Rose Accountancy Corporation, who conducted an audit of Santa Clara County services and determined that one of the functions that would be beneficial to the county was the function of the Ombuds in order to serve as a place whereby people could air concerns and complaints. Again, within the next 5 years, twice, the civil grand jury examined the function of the Ombuds and ultimately concurred with that Harvey M. Rose finding, saying the function of the Ombuds should exist as that continued external mechanism. In fact, in a meeting the other day, it was described to me by someone else as quality control, an external quality control function. And so that speaks to the inception of the Ombuds office. Thank you again.
Could you give Rose a second?